Hello, and welcome back to Nurse Academy. In today's video, we're diving into one of the most fundamental aspects of nursing practice, the Nursing Comprehensive Health Assessment. As a nurse, performing a thorough assessment is key to understanding a patient's health, identifying their needs, and developing a personalized care plan. In this video, we'll break down the process into easy-to-follow steps, so let's get started. Before you even meet your patient, it's important to prepare. Here's what you need to do. Gather any available information. Review the patient's medical records, previous assessments, and any other reports. This helps you understand their background and health history. Ensure you have the necessary tools. You'll need a stethoscope, blood pressure cuff, thermometer, and other diagnostic equipment. Set the environment. Make sure the room is private, comfortable, and conducive to open communication. It's important that the patient feels at ease. Infection control. Always wash your hands before beginning, ensuring cleanliness throughout the assessment. Next, when you first meet the patient, it's time to introduce yourself and establish rapport. Here's how you can do it. Introduce yourself and explain your role. For example, "Hi, I'm Desire. I am a student nurse and I'll be doing your health assessment today." Explain the purpose. Make sure the patient understands that the assessment is important to their overall care and well-being. Build trust and comfort. Be empathetic. Listen actively and ensure the patient feels heard and respected. This is vital in developing a good nurse-patient relationship. Now let's gather important information through a patient interview. This is where we ask about health history. Ask about any past illnesses, surgeries, allergies, medications, and family health history. This provides context about their background. Current symptoms. Inquire about any symptoms they're currently experiencing. Ask questions like, when did you first notice the symptoms? How severe are they? And have they changed over time? Lifestyle factors. Understand their habits by asking about diet, exercise, smoking, alcohol use, and other lifestyle factors. Psychosocial factors. Explore the patient's living situation, social support, and any stressors that could affect their health. Remember to ask open-ended questions to encourage detailed responses. Be sure to clarify any information to ensure you understand their situation clearly. Once we've gathered information through the interview, it's time for the physical examination. This involves assessing various systems in the body, vital signs. Measure blood pressure, heart rate, respiratory rate, and temperature. General appearance. Observe the patient's overall demeanor, posture, mobility, and signs of distress. Head and neck. Assess the eyes, ears, nose, throat, and thyroid. Check for any abnormalities. Cardiovascular system. Use your stethoscope to listen to heart sounds and check for peripheral pulses. Respiratory system. Listen to lung sounds and assess the breathing effort. Abdomen. Gently palpate to check for tenderness, distension, or organ enlargement. Musculoskeletal system. Check for joint movement, muscle strength, and any deformities. Neurological system. Test reflexes, sensation, and coordination. Be sure to explain each step to the patient and ensure their comfort during the process. After completing the physical exam and interview, analyze all the data you've gathered. Look for any patterns, signs, or symptoms that suggest health issues. Focus on the patient's response to health conditions, which will guide your nursing diagnoses. You can use frameworks like NANDA to help identify diagnoses and ensure you address both the physical and emotional needs of the patient. With the nursing diagnoses in mind, it's time to develop a care plan. Set measurable goals. For example, improving blood pressure control or reducing pain levels. Determine nursing interventions that can help achieve these goals. This may include administering medications, monitoring vital signs, or providing patient education. Plan for follow-up assessments to evaluate progress and adjust the care plan if needed. Remember, involve the patient in this process so that their goals and preferences are included in the care plan. Communication and documentation are critical parts of the assessment. Communicate findings. Share your assessment and care plan with the patient in a clear, understandable way. Also, communicate relevant information with the rest of the healthcare team. Document the assessment. Accurately document your findings, nursing diagnoses, care plan, and any patient responses. Ensure the documentation is clear, concise, and follows any standardized formats. Finally, follow up and reassess the patient's progress. Monitor the patient's response to interventions and track changes in their condition. Reassess as needed to ensure the care plan is effective and make adjustments if new concerns arise. Continue to provide support, education, and guidance to both the patient and their family to promote healing and health. And that's a wrap on our Nursing Comprehensive Health Assessment. By following these steps, you can ensure you're providing a thorough, compassionate, and accurate assessment to support your patient's health and well-being. If you found this video helpful, don't forget to hit that like button, subscribe to Nurse Academy, and share it with your friends and colleagues. Thanks for watching, and we'll see you in the next video.